Hello, my name is Chen-Jui HSU, and I will present the case of a pressure therapy intervention for burn hypertrophy scars on the dorsal aspect of the forefoot. Without proper rehabilitation intervention, scar hypertrophy and contracture on the dorsal aspect of the foot may cause metatarsophalangeal joint hyperextension and webspace syndactyly. In severe cases, range of motion of toe joints will be affected, which may cause pain when walking or wearing shoes. Pressure therapy is an intervention commonly used to control post-burn hypertrophic scars, and pressure garment socks are most often used for scars on the feet. According to Laplace law, the level of pressure will be determined by two factors: tension of the fabric and radius of curvature. If we look at the picture below, when fabric with the same level of tension is stretched over a surface with the same curvature, like a cylinder, the pressure will be uniform. But on an uneven surface, areas with smaller curvature will receive more pressure, while areas with larger curvature will receive lower pressure, and concave areas will receive no pressure at all. Because of its shape, pressure will be unevenly distributed over the foot. The radius of curvature of the sides of the foot is smaller, therefore pressure will be higher. The radius of curvature of the instep and sole is bigger, so pressure will be lower. The toe web spaces are concave, so pressure is practically non-existent in this area, and other tools must be used inside the sock to achieve desired pressure. We present the case of a 23-year-old male who sustained second to third degree flame burns over lower extremities on January 19, 2020. During initial evaluation at our rehabilitation center on April 27th, the patient presented with edema of the left foot, as well as many wounds. Because of the presence of wounds signaling unstable scars, use of pressure garments was contraindicated. Instead, self-adhesive elastic bandage like band was used to control edema and scar growth. After 4 months, edema was reduced and wounds healed. Therefore, the patient began wearing pressure garment sock on August 13th. Toe web spaces show signs of hypertrophic scar growth, so autofoam inserts were used underneath the sock to provide additional pressure. By the end of November 2020, scars still show signs of hypertrophic growth. Because skin tolerance to pressure had increased and skin no longer broke or blistered easily, the patient began to use a double-layer pressure garment sock. Also, apart from continued use of autofoam insert in the toe web spaces, another autofoam insert was made to cover the irregular and concave-shaped scar on the dorsal forefoot. Follow-up was done once every month to verify the sock and autofoam inserts. Over time, scars progressively stabilized and matured. Socks were regularly adjusted for better fit. And after 6 months, as fabric lost its elasticity, a new pair was made. New autofoam inserts were made if the previous ones were damaged or no longer fit. The patient began using pressure garment sock and autofoam inserts in August 2020. We can see improvements to toe web spaces by September 2020. The space between toes is bigger, and the syndactyly problem has improved. Scar evaluation using the modified Vancouver scale shows that by March 2021, the scars over the dorsal side of the foot are more pliable, and their height is reduced. If we look at toe movement, we can see that in September 2020, when the patient tries to bend his toes as much as possible, there is still some distance from the floor. By December 2020, the toes can almost completely touch the floor. As scars became more pliable, toe range of motion increased, and by January 2021, toe range of motion had further improved so that toes touched the floor. From this case, we can see that structural characteristics of the body will affect pressure distribution. Even if we use the same pressure garment fabric, the body will receive different levels of pressure. The anatomical structure of the foot is complex, with convex, flat, and concave surfaces. The flat dorsal side of the foot receives lower pressure, while the concave toe webspaces receive no pressure. To achieve utmost scar control, adjustments to the design of the pressure garment sock are required, like using a double layer of fabric, and combined use of other pressure therapy tools is required, such as autofoam inserts. Whatever the type of pressure therapy tool used, frequent follow-up is necessary to keep track of changes in scars and make necessary adjustments to the pressure therapy intervention and/or tools.